The cold and the flu can look very similar. Symptoms are very much the same. People will complain of headache, muscle aches, fever, cough, runny nose, stuffy nose, many of the same symptoms. The difference is really in the degree of severity. The flu is a much more severe illness than a cold. Complications of the flu, like hospitalization, worsening of underlying chronic medical conditions, pneumonia, even bacterial bloodstream infections, are all complications of the flu, but not of a common cold. Certainly, even though the symptoms of the cold and the flu can be very similar, they're more severe in the flu. And yes, there are some people who express the feeling of having been run over by a car or a truck as being analogous to being hit by the flu, because the flu certainly is more severe in its presentation. Usually the time of exposure to the flu to the time that one actually develops the symptoms of the flu can be as short as 1 day and as long as 4 days. Certainly if you develop the symptoms alone, you don't need to immediately contact your healthcare provider, but if they persist, if they get worse, or if you happen to be an immunosuppressed individual with chronic medical problems, I think those are times where you might strongly consider contacting your healthcare provider sooner rather than later. Once you've started your medication, you should stay at home. Make sure you take plenty of fluids. And we ask that people not return to their daily work activities, for example, or school activities until the fever has resolved for at least 24 hours in the absence of any fever-lowering medications. We don't want to get anybody else sick because we have the flu. So please stay home and do so for at least 1 day after the temperature elevations or fevers that you have resolved. In the middle of flu season, December, January, February, which is oftentimes when the flu season peaks, if you haven't yet been immunized, you should be vaccinated against the flu.